in the heart of Yorkshire.
Hello, Mr. Band.
An unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day.
Does it count as my daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives.
It might be that we need to put you to sleep in order to try and sort this out.
Helping loved ones.
It's a shocker, that.
Making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone.
Car door, house door.
Van door.
Big van door.
So it's quite impressive, isn't it?
And everyone.
Oh, you're going to have a good black eye.
Are you a doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it, I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed it.
On shift tonight, Volunteer Jane.
Is that toast okay for you, darling? Toast too dry. I put 4 pats of butter on it.
Dr. Jake Mullen.
Sorry, Mary. All right, just a few seconds and we'll get you sorted, OK?
And advanced clinical practitioner Chantel.
They look her age, attractive, they're best. And on that note, I'm going to get my dinner.
So, get ready to share a shift
My God, look at all these pets. 110.
with the team at Barnsley Casualty.
I can't because I have literally no beds. I've got 90 patients in the department. There's about 12 waiting for AMU. There are no beds, there's no movement.
All right, thank you.
No worries.
Sister Jane has just walked onto the floor to find that every single area of the department is full.
Look at the waiting room, it's just ridiculous.
And she's still got more than 12 hours of her shift to go.
I've got to make sure that they've had all the treatments, that they've had their x-rays, that the doctors have seen them, that the doctor knows what he's doing with them, that any transport that needs booking, that's been done, making sure that the nurses with the poorest of patients in resus are all okay and sorted and they don't need anything else. It's only Jane down in A&E again. Have you got any more beds coming up? Right. It is a bit like, you know, your mind is just going on and on and on.
And as if it wasn't busy enough inside the department, there's now a problem outside too. Dr. Mullen and a team of medics have been alerted to an 86-year-old screaming in pain.
Mary, I'm Jake. I'm one of the A&E doctors, OK?
Right.
All we know is that a lady's fallen over and that she needs caring to. I'm going to get you to take her in and make her sorted, OK? So we're going to have to lift you on it. You might be a bit sore. You might just have to put up with it for a few seconds and then we'll get you onto a trolley, OK? Is that all right? When you get elderly, especially if you're female, and you fall from a standing height onto concrete, your bones can be really brittle. You can move your neck. Is that okay?
Yeah.
All right, I'm fine with that then. We need to get her to resus as soon as possible.
How about we put a sheet underneath and just lift her? Yeah,
That's
that
a
might
plan.
be better. We've got another blanket on the edge of that chair.
Yeah.
Can you roll?
Okay. I got a head.
Lifting Mary straight onto the trolley is too painful.
Oh, they've got a scoop. Wait.
Hey. Nice one, Mark. Perfect. Oh, amazing. Do you want to just break that?
But for once, a car park full of ambulances turns out to be a blessing.
Leave it.
Yeah. This is a head then, yeah?
Right, so if I do this first and try and attach this.
Yeah. I'll clear the neck, so we're okay.
Okay.
Get this out from underneath you. And then we'll just click it into the... Get that out of the way. Bless her. She's on the floor, she's in pain, and she's got all these strangers looking at her.
Very gently.
Yeah,
We need to get...
No, don't leave me.
Sorry, Mary. Alright, just a few seconds and we'll get you sorted, okay? I think it must be a really scary experience for her.
Mary, things might be a little bit uncomfortable while we're moving you around.
Yeah.
Hands across your chest, Mary.
We've got you.
Okay.
You all right there?
Yeah.
Alright.
So we'll go on your boom.
Watch that.
Well done, Mary.
Step 1 complete. Mary can be rushed into resus.
Let's get it sorted from there, booked in and get her x-rayed. Thanks guys, appreciate it. Cheers everyone.
But step 2 is finding out whether her injuries could be life-threatening.
Seeing Mary like this, we've not got the benefit of the paramedics seeing the patient first. Mary, I can tell right now you're in a lot of distress. So as well as having to figure out exactly what's happened, get a bit of a history from her, I'm also having to make sure she's got some initial pain relief because she is in a lot of pain.
Oh.
It's dire. Because there's nowhere to put anybody.
Barnsley Casualty is bursting at the seams today.
It doesn't matter how many patients that you have in A&E, we still have the same number of nurses and the same number of doctors, the same number of beds within the hospital.
When Sister Jane clocked on this morning, she took on the care of 90 patients.
It's got no better. No, 105 patients in the department though at the minute. 105. I just need to transfer a patient from resus.
86-year-old Mary is in resus. But she's not come in the usual way.
The hospital car park seems to be a dangerous place because I get called out there a lot.
And so Dr. Mullen is having to start from scratch to get the vital information he needs.
So Mary, tell us what happened.
I got out of the taxi, I said goodbye, and I just went. I didn't go dizzy or anything, I just went down.
Just went down. And afterwards, where was your pain?
This right there.
All right. So what I'm going to do, Mary, is I need to pop a cannula in so we can give you some pain relief, okay? Mary, what were you in hospital today for?
My eyes, eye test.
Normally this history would be part of the handover, but Dr. Mullen can't prescribe the type of pain relief until he knows more about the patient he's treating.
Have you got any other medical conditions, Mary?
Well, I've had a heart, about 40 years ago, I've had a bad heart attack.
Okay. Anything else? You've never had hip surgery before, have you?
No. This hand, which is a mess,
Yeah.
I've had it broken, the wrist and the hand a couple of times.
And other than the pain in your hip, how are you feeling otherwise? Obviously, I know you're in pain.
Yes.
Are you short of breath at all?
I'm always short of breath.
Okay.
Always.
Mary, I'm just going to pat you down and I want you to tell me if anywhere hurts. Because I know, obviously, I know your hip's hurting, but I need to figure out if you've broken anything. Full stop. Is your collarbones okay?
Yeah.
They're fine.
Yeah.
No pain around your head at all.
Well, I always have because I've had 4 tumours taken out at the Hallamshire.
Okay.
And I've had a bleed on the brain. What is it? Can't think.
An aneurysm.
Aneurysm, yes. That's why my skull's a bit...
When was that?
Not all that long. A couple of years. No more than 2 years.
So any movement here is... Yeah, okay, that's fine.
Full examination complete. There's one final question Dr. Mullen needs the answer to before he can give Mary some relief for her pain.
Mary, do you take any blood thinners?
Yeah, there's something in my bag with my prescription on.
Do you mind if we have a route around?
No.
I've always been taught by my mum to never look in a lady's handbag. Do you never look in a lady's bag without permission?
No, there's not much in.
Patients don't, especially elderly patients, don't necessarily always know what medications they take. So with permission, I'll break my rule, have a look through her handbag and figure out what she's taking.
Red phone.
An emergency is on the way.
Hello, Barnsley A&E. Okay.
Paramedics are blue lighting in a 54-year-old who's had back-to-back seizures at home. Staff nurse Alina is triaging in the ambulance corridor.
Hi, hello. So Paul's been to visit his mum this afternoon. Yeah. He was sat normally in an armchair chatting away to her and then just started fitting. His mum said he sort of came round a little bit but were confused for seconds and then proceeded into second fit. Paul is known epileptic, but he's not had a seizure for at least 4 years. He's had some abscesses removed from his brain. Yeah. The only thing he complained around when he were a headache.
Although Paul appears well, there are too many red flags. Nurse Alina immediately asked Dr. Hidesh Chatter to assess.
He had brain surgery. He had some abscesses on his brain. And we don't know if that's when he started fitting 4 years ago. Right. Because of these.
Right. Dr. Chatter begins an urgent investigation.
Hi, buddy. Is it Paul?
It is, yeah.
I'm Hidesh from the A&E doctors.
All right.
How you doing?
A lot better than what I was.
Yeah, I can imagine. What happened today, then?
I remember going in and talking to my mum for about half an hour.
Yeah.
And then, obviously, my mum says that I had a seizure.
Right, okay.
Then I came round.
Yeah, sure.
And I had another one.
Okay.
So I had two.
So you had 2 seizures in total?
Yeah, 2 seizures.
Okay, and that's obviously unusual for you. How long have you had seizures for?
Well, I had them now for 4 years.
Right, okay. When did you first start getting them?
4 years.
4 years ago, okay. It's something I really enjoy, and the fact that everybody comes in and you've got to try and work out what's wrong with them, whether it be something serious, whether it be something minor, but there's always a puzzle at the end of it.
And I was rushing to Hallamshire Hospital.
Yeah.
Because I found some abscesses on my brain.
Right, okay.
So I had, obviously...
Surgery
there, yeah.
Okay.
But I've had no since.
Okay. So, before today, feeling absolutely fine, no headaches, no vomiting, no fever, no earache, no anything like that, no facial pain, nothing like that.
At all.
The handover suggested another epileptic episode was the biggest risk, but now the examination has taken a different course.
There are lots of reasons to have seizures. Obviously the most common is epilepsy, but it can be something like a bleed in the brain, an infection of the brain. And from the previous surgery, you've not been left with any deficit or anything like that? No weakness or anything like that? No?
Not at all.
Feel okay?
Yeah, tickles.
Tickles, yeah. We start our list with the most serious thing and work our way down, and, you know, we hope we get down to the bottom list. Yeah, it's only reacting normally. It's fine. Okay. Big smile for me? Good. It's more of a grimace than a smile.
I know it is, yeah.
But obviously my main concern is obviously the last time you had a seizures, it was due to these abscesses. Okay. Well, last time, did you have any other symptoms before it? Did you have headaches or anything like that? Or were you unwell otherwise? Either? No. If you were a known epileptic who just had a seizure and we could find a trigger, I'd be fairly happy just to say, don't worry, okay. And obviously it's a bit unusual to get abscesses just out of the blue, so we'll want to just find out a bit more about that. So we need to make sure that hasn't reoccurred. Is that all right?
Yeah, it's fine.
If the abscesses have come back, Paul is in danger of needing emergency brain surgery.
Let's just get this all tidied out and cleaned up, ready for Lexton.
On busy days like today, the team of volunteers like Jane play a vital role in keeping the department moving.
I always feel for doctors and nurses. When it is busy, it's just like a conveyor belt, just one after the other.
What do you know where the air freshener is, do you?
I do. If it's still there, I'll see if I can find it for you. Air freshener. Used to be under here. I think myself and the rest of the volunteers. Has anybody seen any air freshener? We're there to do things, to help patients, to help staff, to do that running about that the staff haven't got time to do. Vanilla. Oh, God, it is vanilla, isn't it?
One of the most vital jobs the volunteers help with
Is that toast okay for you, darling? You reach it there, that's it.
is keeping the patient staying the longest, fed and watered.
Let me just sit you up a little bit. I don't normally get reviews for my toast, but feel free to comment if you feel that my toast is too dry or too wet. Toast too dry. I put 4 pats of butter on it.
Back in Resus,
Is the morphine in?
No, it's just going to be in a bit. It will come soon.
Dr. Mullen is finally able to order some pain relief for 86-year-old Mary.
Hiya Mary, I've got you some morphine now. Just give me your arm. Just we get it slowly, okay? Do you feel that yet?
Oh, well.
Is it easing your pain?
No, not yet.
No? Do a little bit more, shall we? We'll give you a little time to work, and then we'll give you some more if it's not helping, alright?
The challenge now is that Mary needs to be moved off the paramedic's stretcher. But until the morphine kicks in, she's in too much pain.
Have something going to my head?
Well, we just need to take you off this scoop first, and then we'll get you a pillow, okay?
Sorry, Mary. Just going to get this off you, the scoop.
Sorry, Mary.
Well done, well done. I think that morphine's helped.
I'm just silly.
You're not silly. It's pretty typical for elderly patients, especially around Barnsley, to feel some sort of guilt for coming into A&E, but we're here to help.
Morphine in, scoop out, Dr. Mullen can finally order Mary an X-ray and find out how bad her injury is. In cubicle 7, Dr. Chatter needs to take some bloods.
It is. You've got some relatives.
Have I?
54-year-old Paul has had back-to-back seizures and has a history of unexplained abscesses on the brain. Dr. Chatter is hoping Paul's mum will be able to give him some vital information.
Oh yeah, you're right. Did you see the seizure?
He came to our house and he'd been shopping and then all of a sudden Paul's mouth dropped. So I knew as he was having a seizure and then he sent to calm a bit, then he went into another seizure.
Okay.
His face went like that and then he went stiff and his eyes went up.
Yeah. So there was no shaking, it was just stiffness.
It was shaking,
It was shaking
yes,
as well, okay.
yes.
First-hand information is just critical. If somebody can tell us exactly what's happened and how it was seen from their point of view, especially when it comes to seizures, it's really useful. How long did the shaking last for?
I'm not sure.
Roughly minutes.
Few minutes.
Yeah.
Minutes. Yes. When ambulance ladies came, it still wasn't
Back to normal.
coherent or anything. No.
Yeah, sure. All right.
Thank you.
You're all right. No problem.
Dr. Chatter needs to speak to the specialist neurologist to check the best path forward for Paul.
The gentleman's name is Paul. He's a 54-year-old bloke who has a history of epilepsy. About a year ago, he got diagnosed with cerebellar abscesses and had a craniotomy. And as far as I can tell, looking at the last CT scan he had at Hallamshire, he still had those abscesses in situ. He's come back in today with more seizures. A lot of what we do is about managing risk and making appropriate clinical decisions. Great, thanks very much. Cheers, bye. The most important thing in this circumstance is to make sure there isn't a brain abscess. So catching these things early are really important. Right, so I've spoken to them and they want to do a CT scan with contrast.
What's that?
So they inject the dye into you. So basically, if there is some abscesses, they'll shine up a bit better with the contrast vaccine.
Paul is being sent for the highest level of CT scan to give Dr. Chatter as much information as possible.
Long story short,
I need a needle.
You need a needle, yeah. Right, we'll get you around as soon as we can. And then we'll see where we go from there, basically.
Yeah.
Abscesses on the brain can be fatal. Paul and his mum and dad now face an anxious wait to find out if they've returned.
Richard, just in case you want to fill a hot lady.
What's waiting room like?
Chocolate block. 26 booked in it last hour.
In Barnsley Casualty today, the patients keep on coming.
There is one person who sits in an assessment room and deals with every single walk-in patient that comes through the hospital. And it is overwhelming.
They're coming through the doors
Samantha, Rita C can go to AMU.
faster than the team can treat them.
Is that the only one you've got? Yes, she can go to AMU. Patients are waiting to be discharged, they're waiting for the medications to take home, they're waiting for a bed. Relatives are having to wait because you don't know where the patients are and you're trying to find them, so they get frustrated. Have you rung a porter? I can do it, it's all right, love, don't worry, yeah. Nurses are doing the best. There's just no light anywhere. Oh, bless you. Thanks, my darling. OK, I'll get them up. Thanks, sweetheart. Bye, love. Right, that one can go up to 33.
Sorry, sweet.
Am I going over them?
No, it's me pumping trolley up for it.
Phil the porter has arrived in Resus Bay 1.
Whatever you do, put me to sleep.
Whatever I do, put you to sleep. Oh, not doing that, sweetheart.
Mary had a fall in the car park and is about to find out how bad her injuries are.
I'm in my 87th year.
Oh, yeah?
87.
You only look 21. What's up with you?
Oh, thank you.
Oh, you're very welcome, sweetheart.
Hiya, lovey, I'm Jake. I'm going to be doing your x-ray, OK? Just slide that foot back a little bit further for me. That's the one. Well done. Right, my love, really still there for me. Nearly done, my love.
Back at Resus,
There we go. OK.
the results of the X-ray arrives before Mary does.
It's quite a nasty fracture and it's quite bent. Yeah, Mary's in a lot of pain, so she'll need to be admitted and she'll need an operation. I think the first thing I'm going to do is just give her an injection of a nerve block into her hip.
With Mary now back, Dr. Mullen can let her know how the rest of her day, week and probably month at least is going to go.
Bit of bad news.
What?
You've broken your hip.
Oh. I mean, I didn't sprawl out or anything.
I know.
I just went down. Oh.
It's because of your osteoporosis.
Yeah.
So your bones are really delicate.
So careful.
I'm sure.
What's happened? Has it just?
It's just snapped.
Snapped.
Yeah. We'll get you admitted and you'll need an operation, OK? I think the elderly, especially in Yorkshire, tend to be of a generation that they didn't cause a fuss. They would just power on and get through things. These operations, they usually go off without a hitch. The main thing is the recovery time, OK? So average stay is about 10 days. It's lovely that they don't want to cause us a fuss and only be looked after in the most emergency scenarios, but they're not always able to recognise when they are. What we're going to do from now is I'm going to give you an injection into your hip.
Yeah.
To try and numb the pain.
Oh my gosh. Oh.
While Dr. Mullen prepares Mary's temporary pain relief procedure,
Bless you, thank you.
No problem.
Mary prepares for a long stay in hospital. But it turns out she's used to that.
I was a nurse at the old Beckett Hospital, and I loved it every minute.
When was that then, Mary?
Oh, I was about 15, so work it from there.
Let's have a look. So 1951.
But over in the hub,
They're just piling in, it's just phenomenal.
the department is much busier than it was in the 1950s.
120 patients. That's just stupid.
I actually don't think I've been in with 120 before. This is a new one, a new high.
The figures are making worrying reading for Sister Jane.
1, 2, 3, 4, 5, 6,
7, 8, 9, 10, 11.
But over in paediatrics,
Which is number 11? Clever boy.
young Kian is a bit happier about his numbers.
It's gonna be my birthday tomorrow, then I'm gonna be 4 and then 5.
What he's less happy about is his potentially broken thumb.
Hello, buddy. My name's Greg. I'm one of the nurses. I believe you've hurt your hand, haven't you? How did you do that?
I was doing this.
Oh, don't do it again. You might hurt it again.
Slipped over my back and just my thumb.
That's not good.
For his more excitable patients, Nurse Greg has a special formula to get the information he needs.
I think distraction is a technique used with kids, and I think it is the best way. What's your T-shirt say? Mummy's 90 shining armour. That's nice as well, isn't it?
Yeah.
Yeah, you are.
What they're watching on telly, what they do at school, what sports they like to do, just talking and having a laugh. Do you like the dinosaurs?
Yeah.
Which one's your favourite?
Tyrannosaurus.
That's a velociraptor, is it?
No, it isn't.
What is it? Is it a pterodactyl?
Yeah. What's this one called?
Jeff. Can I have a look at your hand? Is that okay? You point to where it hurts the most.
Show the mister where it hurts the most.
There.
At the top.
And you can feel me touching there, can't you? How much can you wiggle it? Oh, you're very brave, aren't you?
Nurse Greg finally gets to the bottom of Kian's injury and doesn't want to take any chances.
So if you want to follow me.
He orders an urgent X-ray.
You can have a drink when we're finished. You got a McDonald's, don't you?
Oh, I thought you'd done with him.
Because you've been fine since, haven't you?
Yeah.
Well, it's about four years ago.
Yeah, about 4 years.
Paul is in cubicle 7 and needs an urgent brain scan, but he's too high risk to be taken up without medical supervision.
Who are you looking for, love?
Another thing for Sister Jane to sort.
He needs CT head with contrast, so he needs to go around with the registers.
Okay, when are they doing it?
They can go ready whenever we are.
Have we requested a porter?
I have requested a porter.
You have?
Yeah.
Okay, so when I get a porter, I'll send a nurse.
Yeah, all right.
While they wait, Paul's mum, Anne, calls his daughter.
Dad's in hospital, Claire. Your granddad and he's here. He's out 2 fits at our house.
Tell her I'm all right.
Yeah, listen. He's all right. Paul, will you just tell our Claire is you're fine?
Claire, I'm fine. Claire, I'm all right. So stop crying. You're all right. And I'm all right.
It's a daughter.
All right. All right. I love you too. Right. Put your hand back on.
Okay, love. I love you. Bye. 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 And you should have tears.
The porter and the nurse arrive. Time for Paul to find out whether the abscesses on his brain have returned.
So if you just took your chin down to your chest for me, I'll let you know that guy's looking.
Yep. CT scans are not the most fun things. For Paul, it must be a very anxious time. The last time he was in the scanner, he was told he had abscesses.
We're going to give you that injection now.
It's quite a closed space, which can be quite claustrophobic. It can be very scary.
Scan complete. Paul returns back to the cubicle to wait for the results.
Nurses are the worst patients.
Back in resus, former nurse Mary is being treated for a broken hip.
I think things have probably changed quite a bit since then, haven't they?
So much.
I always get a bit twitchy when I'm looking after a former nurse or a former doctor. Obviously, I just try and give them the best possible care that I would to anyone else, but I would be lying if I didn't say it doesn't add to my stress level a little bit.
So, Dr. Mullen takes extra care to talk Mary through the treatment and the risks.
All right, Mary, I want to give you a nerve block. That'll just involve injecting some local anaesthetic into your hip, OK? The benefits are, hopefully, you'll have less pain, we'll be able to get you moving. The risks with it is, the main risk, to be honest, is a risk of infection, OK? Given all that, are you happy with if I continue and do it?
Just carry on.
Yeah. All right, Mary, there'll be a sharp scratch, OK?
Don't tell me, just do it.
Well done. All right, Mary, we've injected your groin now, so hopefully in about 20 minutes you'll start to feel a bit of pain relief and we'll get you up to the ward, OK? Is that all right?
That's all right.
Have you got any questions at all?
Not really.
It's not every day that I look after a former nurse in the car park, and it's reasons like this that I just love working in A&E.
Procedure complete, Mary gets wheeled out of resus and up onto a ward. After a 3-week stay, she's now back home.
Mary is quite a character.
Right, let's go.
Right, off we go.
Yeah. It's always difficult treating a nurse or doctor. They always say they make the worst patients because they're always trying to get involved, give their opinion, and you never know quite where to pitch it.
Dr. Mullen may have pitched his patter right and carried out a perfect procedure, but there was one thing he didn't rate so well on.
So all the nurses were making fun of me when I went to get this lady because my trousers were on inside out. In my defence, these scrubs look almost identical inside and outside. It's just the seam. Oh, it's embarrassing, isn't it?
Will you just do me a transfer to resus after that? Oh, it's all right, I'll get Chris. Chris, can you do me a transfer from resus, love?
Just as it's been throughout this shift, as one bed frees up, another patient is on their way. Paramedics are bringing in an 80-year-old who's been struggling to breathe. Advanced clinical practitioner Chantel heads to cubicle 4.
Right, why are you in A&E today then? What's been going off?
Apparently, I've got a low blood oxygen. Well, I've just moved into this home.
Okay, you moved into a care home?
Yeah.
Did the care home staff monitor your oxygen levels and they were a little bit low and they got the doctor out to see you?
Yeah.
Is that right? And then
I got a rattle in my chest.
Okay.
I was really ruttly in my chest. I'd never had that before.
How many days have you had a rattle for?
A couple of days.
A couple of days. Have you had a cough as well?
No, wheezing.
You've been a bit wheezy?
Yeah.
And do you walk around or are you in bed the majority of the time now?
I'm in bedbound.
Okay.
I haven't walked since last year.
You've not walked since last year?
No, but I took 2 steps out of bed yesterday.
Oh, well done.
Because physio finally turned up with a machine. And, I really...
Try and get you going again.
Yeah, I'm so weak. I want to get back on my feet.
Patricia's oxygen levels are worryingly low. Advanced clinical practitioner Chantel needs to find out the reason why.
Nice and quiet for me a minute. Listen to your heart. Nice big breath in. I think I'm naturally a fixer. You are utterly down there, aren't you? Can you sit forward for me? Are you okay to do that? I gravitate towards helping and fixing. Okay, and you can go back now. That's one of the main reasons I do like doing the job that I do.
But before she can help Patricia, the advanced clinical practitioner needs to have more information.
Right, I'm going to get an x-ray on your chest. You're quite crackly at your bases of your lungs. Yeah. So I want to make sure that there's not fluid there, because you've got heart failure, haven't you? So I'll get an x-ray and make sure that it's not infection, or it could be fluid, okay? And then we'll have a chat and come up with a plan.
All right then.
Is that okay?
Yeah, my sister always said you've got to have a plan.
You've always got to have a plan. All right, I'll be back soon. I'll let you read your book.
This is not Patricia's first visit to Casualty. The medic orders an urgent X-ray to check her decline.
Patricia came in March as an inpatient having a chest infection. So the chest X-ray hopefully will show me if she's got any fluid or any signs of infection at the bottom of her lungs. So I want to make sure that hasn't progressed into a pneumonia.
If Patricia does have pneumonia, it could be a sign that her heart is in the final stages of failure.
I've had enough now.
In Barnsley Casualty today, Sister Jane seems to be on the shift that never ends.
It's horrible.
It is. It's relentless.
In a department that's at a standstill.
It's ridiculous when you've only got 20 cubicles, isn't it? You do live off adrenaline when you have a lot of patients in the department. Tracy, it's only Jane. Is there any gynae beds? We've rung them and they've said they've no beds. I'm really struggling down here.
But at last, a bit of good news for Sister Jane.
Beds have come up, so that's the thing. You only need the little ball to start rolling, and then very quickly everybody gets in and seen.
In cubicle 7, Paul is waiting with his mum and dad to find out whether his back-to-back seizures have been caused by his epilepsy or the return of his cerebral abscesses.
So I'm just looking at Paul's CT scan. If you've come in not knowing what's going on, I think the worst thing sometimes in the emergency department is waiting, especially for results. The CT scan's absolutely fine.
Oh, brilliant.
The blood tests show that you've got a raise in your white cell count, but that's often what we see after a seizure anyway.
That's what happened last time, I remember.
So I'm not worried about that.
Yeah.
How do you feel in yourself? Are you back to normal?
Fine, yeah.
I will send a referral to neurology. I'll also send a letter to your GP.
Yeah.
But good, at least the scan's okay,
Yeah,
which is
that's
good news. Okay. Our priority is always to make sure the most serious thing hasn't happened. Are you feeling well enough and going? Yeah, all right. Sometimes the best we can do is reassure and actually telling patients that we've had a good look into things and we've made sure the most serious thing hasn't happened.
Brilliant. Good news, isn't it?
All right.
Thank you, Doctor.
See you later.
Thank you ever so much.
Paul's mum and dad took him home.
Home sweet home.
Discharged into the care of the neurology team, further investigation has shown that the original abscesses were caused by a bacterial infection. Paul's now receiving treatment for that, as well as his epilepsy. Over in X-ray is 4-year-old Kian, who's had a fall.
Oh, great. It's okay. Try and keep still for me. Nice and still, so we can take a better picture.
And waiting to find out what the damage is Mum Becky.
We've got to find those stickers.
Physician associate Helen has the results.
Sticker to you.
Sticker for me.
Because you've been a good boy, nice and brave.
So, Mum, we've got the x-rays back and it looks like there is a little, what we call buccal fracture, so a little sort of compression fracture. They normally heal really well. Takes sort of 3 to 4 weeks. I'll get some stickers and then you're free to go.
Brilliant, thank you.
Do you have any questions?
No, that's it.
All right.
Thank you. So it is broken. She's going to put your special splint on your hand and your thumb to keep it still, but you've got to keep it on, okay?
I don't know if I have any dinosaur stickers. Should we have a look and see? Since you've been such a good
It's like a
boy.
sticker drawer.
I like the doggy.
We haven't got I bumped my thumb, unfortunately.
So cool.
Is it a wolf? What do wolves do?
Oh!
Yeah, they do.
Before the treatment starts, Kian has an important decision to make.
Blue, red, pink or white? One colour.
Red.
Red like Spider-Man?
Yeah.
Well, this is your first broken bone, sweet pea.
Bend your elbow, Russell.
Bend your elbow, mate. That's it. Good boy. Wow. Look how red that is, like Spider-Man. That looks super cool.
Happy with his choice?
That's about it.
It looks like I have styling.
It does.
Yeah.
Oh no, shooting me with webs.
Kian headed home.
Are you going to say thank you?
Thank you.
Goodbye. Brilliant. Thank you very much. Thank you.
After 2 weeks,
This way.
Kian reluctantly had to take off his Spider-Man cast.
Happy day. Let's go. Woohoo.
He's now back at nursery.
Chantel, the love of my life.
Order a porter now. She cubicle 4. She in cubicle 4.
Advanced clinical practitioner Chantel is sending 80-year-old Patricia,
Just keep your hands into.
who has a history of breathing problems, for an urgent chest x-ray.
Gonna sit you up a little bit.
Yeah, it's
Just
the
come
bed
forward.
in the middle.
Is it right at the bottom of your back?
Yeah.
Let's have a look. Bless you.
Oh.
Right, we've got a soft sponge. We
Yeah.
can pop it behind your back and hopefully it'll ease it a little bit.
Thank you.
I'm expecting a lung or a chest infection. However, we need to be aware that there's other causes that we shouldn't miss in A&E, including blood clots, heart attacks, heart failure as well. Fluid can build up in the lungs and also impede that process of breathing.
The advanced clinical practitioner can immediately access the results in the hub.
There's nothing obvious, which is good. She had one in March. There's not much change really.
What are blood size?
A bit infective, but I think it's more heart failure related. Just old age. I'll go deliver the good news, but she's still coming in. She might not be happy with me in a minute. So I've had a look at your x-ray. There's no pneumonia or anything on your chest x-ray.
Good.
We'll keep you on this oxygen and we'll let the medical consultant have a good look at you upstairs.
Tonight or tomorrow?
It'll probably be tomorrow now.
I can't thank you enough.
Oh, you're okay. Any questions for me?
No, I think you're doing a grand job.
Thank you.
You're the nicest doctor I've ever seen. I've seen you more attractive than my own doctor.
See, I'm attractive.
Yeah, yeah,
I'm the best.
yeah.
Anything
How
else?
long have you been here anyway?
What, since I was 16?
Really?
I'm 31 now.
She doesn't look it, does she?
Another one? Don't look her age, attractive, the best. And on that note, I'm going to get my dinner. When patients give you a compliment, it's really cute, but and it's nice from a woman as well. I've got you some cake and sandwich.
That's smashing that. That's lovely.
Okay.
Yes.
Can you get to
You've got
everything?
lovely skin, you know.
I've got lovely skin.
Yeah, you
It's
have.
another. You've given me some good compliments today.
Yeah, you have. She's beautiful, though, isn't she?
Generally, it's the old men that you get the compliments from.
Thank you for this.
See you later.
Thank you. This is the best. You know what I said about the NHS being rubbish? I take it all back.
Let's go. Patricia was taken up to the ward, but was soon well enough to go home.
Day staff, you can go to hand over debrief. Thanks, guys.
Today's mammoth shift is finally at an end,
Right, who's coming with me?
and Sister Jane knows exactly who to thank.
When you work in a team as close as ours, it's a massive help because, you know, the team itself will pick you up. That's who you go to. Good evening. It's not very nice. There's currently about 110 patients in the department with a 3-hour, 50-minute doctor wait.
But as she hands over to the next team, a sense of perspective kicks in.
A busy department with 120 patients in it, then yes, it is challenging, and it's always going to be challenging. But for us as a team, I think that biggest challenge came with COVID, and we got through that. See you, Sam! Nothing will ever compare with that.
Life still beating in these crumbling walls. Tonight we sing where nobody sees. In the junkyard we are free. Underneath the moon silver haze, we'll embrace these throwaway days. Lost souls and cobbled parts create art with our mended hearts. Every scratch has a story to tell in this haven of heaven and hell. Old guitars strum a haunting tune underneath the pale forgotten moon. Oil-stained fingers dance in grace, finding rhythm in a discarded place. Tonight we sing where nobody sees. In the junkyard we are free. Underneath